In this video, we are going to talk about the difference between implantation bleeding and period bleeding, the timing of implantation bleeding and the signs and symptoms of implantation bleeding. So, let's start with the difference between implantation bleeding and period. Implantation bleeding and period bleeding do not happen at the same time. Implantation bleeding comes first, usually earlier than the time you would expect your menstrual flow. The first day of your menstrual cycle is the day 1 of your last period. Women with a regular 28-day cycle should ovulate around days 14 to 16. Like we earlier stated, the release of an egg from the ovary into the fallopian tube is called ovulation. The egg can live for about 24 hours after release from the ovary. The sperm cells, on the other hand, can live for about 3 to 7 days. After the egg has been fertilized by the sperm, it implants into the wall of the uterus around days 22 to 26, that is if you have a regular 28-day menstrual cycle. So, if you notice light bleeding that occurs before your expected period date, there is a good chance it is implantation bleeding and not your menstrual period. So how do you differentiate between implantation bleeding and period?
Let's start with the timing.
Implantation bleeding comes earlier than period bleeding. It can occur between days 22 to 26 in a woman with a regular 28-day cycle. Talking about the color of implantation bleeding. The blood in implantation bleeding is not brightly colored. It can be pinkish brown, dark brown, or black blood. It is dark because it is old blood. Fresh blood that is bright red becomes darker as it gets old. Period blood occurs as a result of the shedding of the uterine wall, also known as the endometrium. Period blood can be bright or vibrant red. This is because it is fresh blood. Sometimes menstrual bleeding can start as pink or brown and change into crimson red with time. The next to consider is the strength of flow. Implantation bleeding is usually very light bleeding, and that's why it is sometimes referred to as spotting. Most women don't know when it occurs. They just observe blood stains on their pants while changing or may not even experience any spotting at all. On the other hand, your periods may start light and the flow gets heavier as the day goes by. The cramps you experience during implantation bleeding cannot be compared to that of your period. Implantation cramps are usually short-lived and mild. Period cramps, on the other hand, last longer, a few hours to a day or two. It is usually stronger than what you experience during implantation bleeding and can affect the daily activities of some women. You may not need any medications for implantation bleeding pain or cramps. Menstrual cramps may require drugs like diclofenac or paracetamol to relieve the pain. Clotting is another factor to consider when differentiating between implantation bleeding and period bleeding. Clots rarely or almost never occur during implantation bleeding. However, if you notice clots, which is a mixture of blood and tissue, you are most likely seeing your period. Another factor to consider is the length of flow. Implantation bleeding lasts between 1 to 3 days and it's very light. As stated earlier, most times, women do not know when it occurs. Period bleeding, on the other hand, lasts between 2 to 7 days and may be heavy. Consistency of flow is another factor we will look at. Implantation bleeding flow is usually on and off, while your period bleeding starts lightly and gets progressively heavier as the day goes by.